Hello, and thank you everyone for joining today's webinar on the impact of the COVID-19 pandemic on routine immunization programs. My name is Aishwarya Shah, and I'm a project officer for CanVax at the Canadian Public Health Association. And I will be the moderator for today's webinar. It is our pleasure to be collaborating with Immunize Canada on another webinar series on the topic of immunizations during the SARS-CoV-2 pandemic. To learn more about our upcoming webinars, please visit our website at canvax.ca/join Immunize Canada and CanVax webinar series as indicated in the link you see on the screen. Before we begin, we want to acknowledge that the offices of Immunize Canada and CanVax, which are part of the Canadian Public Health Association, are situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. Immunize Canada, CanVax, and CPHA are committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. So before we begin, as for a bit of housekeeping, it should be noted that all attendees are muted upon entering into the webinar. For this webinar, the Q&A feature located on your toolbar will be used to ask questions. If you have any questions, please type them in the Q&A box. You can do so at any point during the webinar. Only you, myself, and the presenter can see your questions in the My Questions section. When asking a question to the presenter, the question is first read out loud, answered live by the presenter, and then posted in the All Questions section. If you have questions regarding technical difficulties, please contact canvax@cpha.ca, and we will reply to you as soon as we can. If multiple people are experiencing the same technical difficulties, we'll address it live via a broadcast message in the chat. So before we begin, we have two quick notes. Firstly, this webinar is being recorded and will be made available on Immunize Canada's YouTube channel and on canvax.ca a few days after the end of this presentation. Presentation slides will be shared with attendees in a post-webinar email and will also be available on canvax.ca. Our second note is that we invite everyone, all the attendees, to take a short 5-minute post-evaluation survey at the end of this webinar to provide your feedback. And so with that, let's begin. First, I would like to introduce our speakers for today. Our first speaker is Dr. Shannon MacDonald. She is an associate professor in the Faculty of Nursing and an adjunct in the School of Public Health at the University of Alberta. Her program of research focuses on developing evidence to support immunization best practice, programs, and policy, and to promote informed decision-making by parents. Her passion is working directly with policy advisors and clinicians on research that informs their immunization policy and practice decisions. Dr. MacDonald and her team have been funded by the Canadian Institutes of Health Research to assess the impact of the pandemic on routine immunizations across the lifespan and the acceptability and access to COVID-19 vaccines by underserved populations. The project involves researchers, clinicians, and policy advisors from across Canada with the aim of informing national, provincial, and territorial pandemic immunization strategies. Our next speaker is Mr. Yuba Paudel. He's a PhD candidate at the School of Public Health in University of Alberta. He received a Master's in Public Health in 2013 from the University of Auckland in New Zealand, majoring in epidemiology and biostatistics. He holds a master's degree in sociology from the Tribhuvan University in Nepal. He has worked in Nepal for nearly 7 years for various organizations in research and evaluation positions. He has authored nearly 20 papers, most of them related to maternal and child health in different journals. He's currently working as a data analyst for the COVID-MM project under the supervision of Dr. Shannon MacDonald. And with that being said, I would like to turn it over to Dr. MacDonald and Mr. Paudel to begin the presentation.
Absolutely. Great. Thanks very much. Well, welcome everybody, and thank you very much to CanVax and Immunize Canada for the invitation for us to share with you some of our findings on the impact of the COVID-19 pandemic on routine immunization programs. I'd like to identify that we're speaking to you today from Edmonton, Alberta, which is the traditional lands of First Nations and Métis people in what is now known as Treaty 6 and Métis Region 4. And I feel very fortunate to live in this beautiful land that has been and continues to be the home of Indigenous peoples long before my family arrived here. The information we're going to share today is based on work we've conducted in Alberta on the impact of the pandemic on routine immunizations. Well, of course, a lot of attention is being focused on achieving high uptake of COVID vaccines. It's important that we not forget the routine vaccine programs that have protected us from diseases like polio, measles, and pertussis over the years. We absolutely cannot put ourselves into a position where we emerge from this pandemic only to be faced with outbreaks of other vaccine preventable diseases due to low uptake of routine vaccines during the pandemic. And this is actually a very real possibility. Coverage levels for many of these vaccines were barely high enough to maintain community protection before the pandemic. So any drop in coverage due to the pandemic, when combined with removal of public health restrictions and return of international travel post-pandemic, could result in importation and spread of any number of infectious diseases. Today, we're sharing with you results from our analysis of early childhood and some preliminary work on school-based vaccines in Alberta. Other ongoing work by our team includes similar work in other provinces, as well as more in-depth analysis of school vaccines and examining the impact on vaccines delivered to adults, including pregnant women. So in the talk today, we're going to briefly just cover the timeline of public health restrictions because it does have an impact on the patterns you're going to see in the data. We're going to briefly touch on the recommendations from NACI, the National Advisory Committee on Immunization, on continuity of routine vaccine delivery during the pandemic. And then we're going to present some results from our work on infant immunization coverage, some preliminary data on school vaccine coverage, and then some suggested strategies for catch-up that are being used in Alberta and might be applicable in other provinces as well. So the learning objectives for this session, by the end of this session, we hope that you'll go away understanding the extent to which routine vaccine coverage declined during the pandemic compared to the pre-pandemic period. We'd like you to understand whether those children who missed getting vaccinated during the early pandemic are getting caught up later in the pandemic, and to understand strategies adopted by the province of Alberta for catch-up. So starting off with some timelines. This, I'm sure, is old news for a lot of us, but just to remind us ourselves, because it feels like 100 years, but in fact, it was December of 2019 when the COVID-19 pandemic started in China. And then the pandemic was declared by the World Health Organization in March of 2020. And March 17th, 2020 is when the first public health emergency was declared in Alberta. We are currently in a state of public health emergency yet again in Alberta. So the timeline of public health restrictions in Alberta in 2020 are presented here. And I've just highlighted a few of them because, again, they'll be of interest when you look at the patterns in the data. So in March of 2020, public health restrictions were first implemented in the province. As cases decreased, some of those restrictions were eased in May of 2020, and businesses and other services began to reopen. And then in October to November 2020, we saw a rise in cases again and the implementation of new public health restrictions being implemented. So that's the context in which this study was conducted. Now, looking at the recommendations for routine immunizations, I've just highlighted here the ones that are relevant to the topic we're talking about today. So first of all, infants and toddlers. So the National Advisory Committee on Immunization, as well as Alberta Health and Alberta Health Services, identified that infant and toddler vaccines should be prioritized, particularly the primary immunization series, with, of course, some modifications to immunization service provision. So, for instance, shorter appointments that were focused only on immunization. So the public health nurses were not implementing their usual screening and developmental testing. Personal protective equipment, of course, was in use, and social distancing. For school-age vaccines, the recommendation is that routine school-age vaccines could be deferred until schools reopened or full health services were available to start catching kids up. It was also highlighted that the vaccine series doesn't need to be restarted if it's interrupted for these routine vaccines, and that children who were eligible for vaccination would continue to be eligible even if they technically aged out of the program. So they'd remain eligible for catch-up. And one thing I'll just highlight before we move on is that vaccinations for children in Alberta are provided exclusively by the public health system, so public health nurses. So we don't have physicians providing immunizations in pediatric or family practices. So I'd like to just tell you a little bit about the project that we're reporting on today, which was funded by a CIHR COVID-19 Rapid Research Funding Opportunity, and it was augmented by additional funding from the Canadian Immunization Research Network. The project we've termed the COVIM project, and it includes researchers from 6 provinces as well as knowledge users. And I'll just briefly identify these on these slides, just because, credit to all these folks who have kept all these activities ongoing despite all their other commitments. So this is the research team members, and really want to highlight the knowledge users on our team. They have been extremely active in involvement. Matthew Tunis from the National Advisory Committee on Immunization Secretariat has been a fantastic resource identifying what gaps in knowledge our team can address. So we've been able to adapt our activities to really provide information that is of priority to our knowledge users. So the larger COVIM project is a multi-method national study that incorporates data from 4 complementary approaches. That includes an environmental scan of public health leaders and policy documents, which was completed very early in the pandemic to understand what strategies were in place across the country. And that work has recently been published. We also conducted 2 cross-sectional, we're about to conduct the second of 2 cross-sectional pan-Canadian surveys of the public and healthcare providers. We're in the process of interviewing members of equity-seeking groups to identify access barriers to immunization. And the piece I'm going to report on today is analysis of routine vaccine coverage data. And specifically in Alberta is what we're talking about today. So I'm going to turn it over to my colleague, Yuba Paudel, who is going to present the findings on the impact of the pandemic on infant vaccination coverage.
So, yeah, as I'm told, now I'm going to talk about the impact of COVID-19 pandemic on infant vaccine coverage in Alberta. So this is the infant immunization schedule in Alberta. And so we are looking at 3 vaccines: measles, rotavirus, and pertussis containing vaccine. So measles vaccine given the first dose at 12 months. Rotavirus vaccine given 3 doses in 2 months, 4 months, and 6 months, as well as pertussis containing vaccines given at 2, 4, 6, and 18 months. We are not including meningococcal and pneumococcal vaccines in this analysis. So we are focusing on 3 antigens. So for this analysis on infant vaccine coverage, we used administrative data available from Ministry of Health, Alberta, and data were extracted in May 2021. So vaccine coverage was defined as the proportion of age-eligible children who were vaccinated by 1 month past their due date, including the day they turned 1 month past their due date. And we measured the impact using 2 measures. So first one is the monthly coverage. So we used monthly coverage to see whether children received timely vaccination, and also looked at, so the purpose of using cumulative coverage was to look at the follow-up data and to investigate whether those missed to get vaccination by 1 month past their due date were caught up later. For monthly coverage, we calculated coverage difference, that is 2020 coverage minus 2019 coverage, to see if coverage was higher or lower in 2020 compared to 2019. And we looked at the 95% confidence interval of that difference to see whether 0 was included, and so to test the significance of that difference. And for cumulative coverage, we compared the actual cumulative coverage and examined whether those coverage after a follow-up of, let's say, nearly 1 year were overlapping or not, to measure the significance of difference. So this graph is showing difference in monthly coverage for measles containing vaccine. So 2020 coverage minus 2019 coverage. And the bolded months indicate that coverage significantly differ between the corresponding months in 2020 and 2019. And we can see that the difference is positive in January and February of 2000. So before the pandemic started. So graph also shows that 2000 coverage was higher. So this is indicating that before the pandemic started, the coverage was higher in 2020 compared to 2019 in Alberta. But as the pandemic started in March, April, the difference started to become negative. And it was significantly lower in April and May 2020 compared to corresponding months in 2019. So we can see that as the pandemic restriction loosened after May, June, July, the coverage in 2020 increased and almost reached to 2019 level. So when we are seeing this difference is 0, means the 2020 coverage is in the level of 2019 coverage. So it reached to 2019 level between July and October. And as the second wave of the pandemic was observed, and we can see that when restrictions were again put in place, the difference became negative again, indicating significantly lower coverage in 2020 compared to 2019. So this graph is showing the coverage difference for 3 doses of rotavirus vaccine. And the superscript letters again indicate that which dose had a significant difference in coverage between 2020 and 2019. So again, here we can see that difference is positive. That means 2020 coverage was higher in January and February compared to 2019 in the first 2 months. And as the pandemic started, the difference became negative. And it was significantly lower in April and May 2020 compared to corresponding months in 2019, except for the 3rd dose. So for 3rd dose, we can see that the coverage increased in 2020 compared to 2019. And we consulted with public health managers, and we found that after the initial reduction of vaccine service delivery at the start of the pandemic, many community health centers were contacting parents of 6-month-old children to get them vaccinated before they age out of the rotavirus vaccine eligibility, because 3rd dose of the rotavirus vaccine needs to be given within 8 months. So that increased attention among that to give 3rd dose, increase the coverage there. And again, we can see that in November 2020, coverage for 3rd dose was higher compared to 2019. Now, this graph is showing the difference in monthly coverage for 4 doses of pertussis containing vaccines. And the bolded months again indicate that the coverage significantly differed between the corresponding months in 2020 and 2019. The superscript letters show that which dose had a significant difference. And this graph pretty much follows the trend observed for rotavirus vaccine, with coverage higher in 2020 compared to 2019 before the pandemic started, and significantly declined as public health restrictions were put in place. As the pandemic restrictions were loosened, the coverage in 2020 increased again and reached to 2019 level from July onwards, except for the 3rd dose. So for the 3rd dose, we again see here that in the May and November, the coverage was increased. And the 4th dose declined after September again. So it's corresponding with the second wave of the pandemic in Alberta. So now we are coming to the cumulative coverage part. So what we are trying to see here is that those children who were missed to get vaccination in their 1 month past their due date. So measles is to be given at 12 months, and we started following up them since 13 months. So the March, we are plotting here for the March and April, and we can see that pertussis March and April cohorts had the greatest impact of the pandemic, because March and April cohort had the greatest impact of the pandemic. So we are focusing on those 2 months. And as I mentioned before, our objective here was to look at whether those missed earlier were caught up later. And we can see that 95% coverage are not overlapping even at the 25th month for the March cohort. And that means those who were missed to receive vaccination in March and April 2020 still remain unvaccinated until April of 2021. So even after a year of their due date, they still remain vaccinated, and this proportion is still like, we can see the difference is 5% of the children are nearly remain to be vaccinated even after 25th month for the measles vaccination. And this graph is comparing cumulative coverage for first dose of pertussis containing vaccine. And the left graph is for the March cohort, and the right one is for the April cohort. And the cumulative coverage, we can see that there for March cohort, they are very much similar in 2019 compared to 2020 coverage. And the right side and for the April cohort, we can see that although lower proportion received vaccine in April 2020 compared to 2019 April, by the 3rd month, those missed earlier are caught up during follow-up. That means cumulative coverage is not significantly different in April 2021 at 14th month of their life. So this graph is comparing cumulative coverage for second dose of pertussis containing vaccine, and we can see that lower proportion received vaccine in March and April 2020 compared to 2019. A significant proportion of those missed earlier are still left to be vaccinated at the follow-up, in the follow-up period. So we can see that the confidence intervals are not overlapping. Now, for the 3rd dose of pertussis containing vaccine, we are comparing again the March and April cohort here for both 2019 and 20. So the left one is for March, and again right one for the April cohort. And we can see that lower proportion received vaccine in March and April 2020 compared to 2019. And those missed earlier are caught up during the course of the pandemic at the end of the follow-up period. And the cumulative coverage are not significantly different in April 2021. So this might be due to the increased attention to receive rotavirus vaccine within 8 months. And now for the 4th dose of the pertussis containing vaccine, we can see that lower proportion received vaccine in March and April 2020 compared to 2019. A significant proportion of those missed earlier are still left to be caught up at the end of the follow-up, since we can see that cumulative coverage difference are significantly different. The confidence interval don't quite overlap. We are only presenting pertussis vaccine here for the cumulative coverage because rotavirus cumulative coverage looks similar. But rotavirus vaccine has a shorter follow-up time because there is a limit to maximum age when rotavirus can given So for the third dose, the rotavirus vaccine can be given until 8 months only. So we haven't presented the rotavirus follow-up data here. So overall, from these findings, what we can say is that the vaccines given at older ages, so the measles vaccine given at 12 months, and then pertussis containing vaccines 4th dose, they have a greater impact due to the pandemic than those given at earlier ages. When we are comparing both the monthly coverage and the cumulative coverage difference, and the higher impacts were observed when there were stricter public health measures were put in place. Yeah, so that's it from my side. I'll hand over to Shannon to discuss about the school vaccine uptake during the COVID-19 pandemic. Thank you.
Thank you, Yuba, and thanks for your great work on that. Yuba's the analyst who's been doing all this work. Now we'd like to share with you some preliminary results on the impact of the pandemic on school vaccine uptake. This information we're going to present is actually drawn from publicly available aggregate data provided by Alberta Health, and our team is currently in the process of doing more detailed analysis using the individual level data, similar to what Yuba has just presented to you for the infant vaccines. So here we have the results for the 2 vaccines routinely provided to students in grade 6 in Alberta, which is the human papillomavirus HPV vaccine and the hepatitis B vaccine. So this chart here shows a comparison of coverage for 12-year-olds in 2019 in the light green bars compared to 2020 in the dark green bars. So starting from the left, you see hepatitis B vaccine dose 1 and 2, and you see that coverage for dose 1 is pretty comparable between the 2 years, which makes sense because the hepatitis B vaccine dose 1 is administered in the fall of the year. So fall of 2019, before the pandemic started, wouldn't have been impacted. The coverage of second dose coverage for hepatitis B vaccine in 2020, you can see, was greatly reduced compared to 2019. So it dropped from 72.6% down to 28.1%. And that's because the second dose would have been due in the spring of 2020, but schools had closed. And so, of course, programs were on hold. The HPV vaccine, so the next 4 sets of bars reflect the HPV vaccine coverage, and they're split into males and females, which is available, as I mentioned, from Alberta Health. And the coverage for these shows that HPV, again, first dose was not really impacted much, but that the second dose was hugely impacted by the closure of the schools. So second dose coverage, for instance, for females in 2020 was 9.8% compared to 65.5%, what it would have been the year before. One of the other school programs we'll touch on here is this is a catch-up program that's offered. So in Alberta, what happens is the preschool vaccine doses, which would be DTaP, IPV, MMR dose 2, and varicella, typically administered as part of the MMR vaccine, MMRV. So what happens is kids are supposed to receive these in preschool, but they do a catch-up campaign in grade 1 just to catch up those kids who didn't get it in the preschool period. So we wanted to see whether those catch-up programs, how they were operating throughout the pandemic. And you can see slightly lower coverage, but not a great deal. And that really reflects the way the program rolls out. So the program starts at the beginning of grade 1. They do their assessment of kids. They send out reminders to parents, and they can catch those kids up. The other thing is that they did some catch up in the summer of 2020 for these kids to be sure that they were protected. So you see a small impact by age 7, but not a great deal. So now just moving on to strategies for catch-up. So these are the strategies that were used in Alberta, and you know, probably there's some similarities to other provinces. depending on their programs. As I mentioned, the program in Alberta is largely public health delivery, so they might look slightly different because of that. So first of all, strategies for catch-up for infant vaccines. So after that initial reduction of vaccine service delivery at the very start of the pandemic, many community health centers were contacting parents, particularly of 6-month-old children, to get them vaccinated before they aged out of rotavirus vaccine eligibility. And you saw that that had a really fantastically effective a fantastic effect on uptake of that third dose of rotavirus, as well as the DTaP containing vaccine that's due third dose at the same time. And now we need some additional strategies to catch up those kids that missed some of their other vaccines. So for school immunization catch-up in Alberta, for vaccines missed in the 2019-2020 school year, so that would have been, the April, May, June of 2020, catch-up was offered both through the summer in some zones of Alberta, as well as through the regular school-based programs in schools in the following year. So in the fall of 2020, there was some catch-up going on. Public health nurses really pushed to complete the 2019-20 catch-up before moving on to the new cohort that was coming in. So a few additional things about what went on during the past school year, 2020-21. So public health nurses in Alberta were going into schools to provide the school-based programs. I know in some provinces and well, in particular municipalities, public health wasn't welcomed back into the schools last fall. But in Alberta, they were allowed in the school unless there was an outbreak declared at the school, and then they weren't allowed to go in and had to reschedule the immunization day. Parents could also take students to the public health clinics to be immunized, and students who were not attending in-person classes, so as in many jurisdictions, online classes were an option. Those kids could come to the school for the immunization day, or they could go to their local public health clinic to get their vaccines. And some school boards even arranged for specific places for at-home students to be immunized, for example, at a school district office. There was a real focus on the grade 9 program because in Alberta, we don't have public health nurses in the high school. So there's no immunization program in the high schools. So in Alberta, kids move from junior high to high school in grade 10. So the priority was to make sure grade 9 students were all caught up while they were still in junior high, so that nurses aren't being required to catch them up in the high schools. And nurses made a lot of efforts to come on alternate days to catch up some students who missed the immunization clinic. So huge demand on public health nursing staff at a time that they were understandably really quite stretched. So I think it's impressive the work that they've accomplished. In terms of future catch-up plans for school immunization, some zones held mass catch-up clinics throughout the summer of 2021. And really they're pushing, as I said, to complete that first cohort that was impacted, and then continuing with catching up the cohort that was impacted in the second year. And for the 2020-21 cohort, they're planning to catch up missed doses in grades 1 to 3. So that's those preschool boosters that were missed. And then they'll focus in on the kids in grades 6 to 8 who might have missed their HPV and hepatitis B vaccines. So that's the end of our presentation. I'd just like to thank Yuba for all his hard work on this, as well as Hannah Sell, one of my other students who's going to be working on the school-based vaccine analysis, and the project coordinator, Ali Assi of the team, and certainly the entire COVIM study team that I shared in a previous slide.
Okay. Perfect. Thank you, Dr. MacDonald and Mr. Paudel, for your presentation. At this point, if you have questions, please submit them using the Q&A feature. As a reminder to everyone, you can also submit your questions anonymously. Any questions that are answered live will appear in the Q&A window under the All Questions tab. All right, I see that we have one question. So one of the questions submitted is, what is the suspected reason the 4th dose of pertussis vaccine 2020 coverage was so low?
So maybe I'll try that, and Yuba, if you have anything to add, certainly jump in. The recommendation from NACI and from Alberta Health was to focus on the primary series, and so they were really focusing on that 2, 4, 6 month delivery, and 18-month delivery, absolutely, if they were able, if they had capacity to do so, but it wasn't, that booster was not really the prioritized. It was absolutely a case of limited resources and where to spend them best. So that's the most likely reason. There, there's, you never know. That's the downside of administrative data. You don't always know the reason why, and that's why qualitative work is such a great complement to this type of work, because it's also possible that parental perceptions about vaccination differ, and we do know that 18-month coverage always tends to lag, but in this case, it's particularly low in the pandemic year. So hopefully that answers your question, Caitlin.
So we have another question submitted from another attendee. So the question is, I'm interested in knowing what database is used in Alberta to capture immunization data. Also, is the responsibility to report immunizations to the government on the parent or the provider? In Ontario, it seems to be the responsibility of the parent, so I wonder how well immunization data has been captured in this province during the pandemic.
So Yuba, do you want to talk at all about the database, and I could talk about the second part of that question?
Yeah, sure, Shannon. So in Alberta, Ministry of Health has an immunization repository. So immunization providers from regional health authorities are reporting to the Ministry of Health, and there is a immunization repository called Imari, where we can find vaccination data about all the immunization. So the personal health number is linked with the immunization. So what antigen was received in which dates. So all those are recorded in a database called Imari.
Okay.
So the second aspect of that is around how complete that is and whether we rely on parents to submit that data. So in Alberta, childhood vaccines in particular, we have probably some of the best. I'm bragging a little for Alberta here. Alberta Health has some of the best data in the country, really, because public health is the only provider of childhood routine vaccines. And what happens is when it's provided in one of the 5 zones of Alberta, each of those 5 zones collects the data at the time of administration. So it's the responsibility of Alberta Health Services to do that. And then they submit that data to the Ministry of Health. There's also some new legislation in Alberta that now makes it mandatory for any vaccine provider to submit data to Alberta Health. So even for vaccines beyond the childhood series, adult vaccines, etc., the requirement now is whether you're a pharmacist or a physician or public health, you must submit your data to Alberta Health. So going forward, we're going to have really comprehensive data for all our other programs as well.
Okay.
I feel a little, spoiled here in Alberta, just the fact that we have data on every single vaccination provided to children.
Wow, that's really interesting. Right, so, okay. So it seems that we have no other questions. So that brings us to the end of this webinar. If you have any questions for Dr. MacDonald and Mr. Paudel, please, after the webinar, please submit them to canvax@cpha.ca, and we will forward your questions to them. So this brings us to the end of the webinar. Thank you all for joining us today. And again, thank you to Dr. MacDonald and Mr. Paudel for the wonderful presentation. As a quick reminder to all attendees, please don't forget to fill out the survey upon closing the webinar window on your device. We look forward to your feedback so that we can make improvements based on your suggestions. Thank you again and have a wonderful afternoon.